frequently hit it or bump into it with toys and such. So it was just such a problem. And he would be one, like if I would see him at Meijer, I would run the other way because I didn't know what to do for him. It was just the most frustrating experience I've ever had in my life. And nothing worked. And like a couple of years later, I was contacted by the news and by a reporter for the paper, and they asked to do an article on this case. And did I tell you this whole story? No? So they asked to do a story on this case, and I said, I've helped like hundreds of people, and you want to interview me for the one patient I never helped? No. You cannot use my name, you cannot use my facility where I work, I am not doing an interview, I don't want anything, you do not have my permission for anything. And so then the patient ended up calling me and telling me the reason why they wanted to interview me is he had decided to have an elective amputation of his arm. And so this was happening, they didn't put my name in the newspaper article, thank God. He was on the news, on TV, like, because this is happening this week, and the night before, and he had gone to counseling to prepare for the elective amputation, and the night before the surgery, his auto insurance denied coverage of the amputation. Because they were concerned if they amputated the hand, the complex regional pain syndrome could move proximal, and there is some literature out there that demonstrates that it can do that. So they elected to not do the surgery. So I was just like, oh my gosh, you know, just terrible. My heart was out. He was such a nice guy. He was a veteran. I mean, he was such a good guy. And so a couple years passed, and I go into work, and the front desk calls me and said, guess who's coming back to therapy? Who called and is coming back to therapy? And I lay out a couple people. This person's, nope. And I'm like, who? And she's like, the one person that you never helped. He's coming back. And I'm like, what am I going to do? I don't know what to do for him. There's nothing I can do. So I call him. And I'm like, okay, what's going on? And he goes, I can't explain it, but something is different in my hand. I don't know what it is. It was springtime. He said, maybe it was like this time of year. Maybe because the weather has changed and it's starting to get warmer. Or I don't know, I can't explain it, but my hand feels differently. And he had called me in between, like one time his son had hit his hand with a little fire truck and it opened up into a wound, and he wanted advice on what to do, and just he got to the point where he wouldn't even wash his hand because it wasn't a part of him. And it was dirty, his skin integrity was bad. It was not good. And I also didn't know all this, that in that time that I didn't see him, he ended up getting divorced from his wife. And at the time that he had called me and wanted to come back, he was engaged to somebody else. So lots of things had changed in his world. He still wasn't working because his job was to repair refrigeration trucks. And he couldn't use his hand for anything functional at all. He still wore the splint. That nasty splint. And he wanted me to make him a new one. I'm like, I can't, your doctor does not want you to have one. Like, I can't make you a new one. And so he came in, and I did the exact same thing I did the first visit, other than make the splint. Started with range of motion exercises. I was, doing manual lymph drainage, because his hand had this really thick, pitting, brawny edema. It was horrific. His skin was bad. He came to therapy, and I said, we're just going to try this a few visits. If you don't show changes, I really can't justify seeing you. He's like, okay, I think it's going to be different. And then the next time he came in, he had showed changes in range of motion and a decrease in edema. And he just kept getting better and better and better. Don't know. So here's his hand volarly. You can see this scar, which is why we do the Z-plasty for surgical interventions, because it contracted down. I wasn't seeing him when that happened, but he did go to the ER and was treated. He went to his hand surgeon and was treated. So here's him volarly. Here's him from the side. He only has this flexion contracture at the PIP because of that scar from where his son hit him with the truck. Otherwise, he likely would have had full extension. You can't really see the edema there, but you can see it better here. He still had this presentation of edema that was no longer pitting on the dorsum of his hand, and again, his flexion contracture at the PIP joint from that scar. And then the good thing is here's his fist. Like when I started seeing him and when I stopped seeing him, his fist was probably this. It was terrible. Worse than when he started. Worse than when he started. And he got a full fist. So I don't know if it was that the psychosocial issues in his life had changed. Don't know. Don't know. Did the exact same things I did before, and this time it worked. We tried mirror therapy. We did lymphedema management. We did all, everything. But the big thing with constitutional pain syndrome is you don't want vigorous. You don't want vigorous. I had a lady once that had, I can't remember her procedure, but she couldn't go to therapy in Grand Rapids because she lived way up north. And she said she would go to therapy and she would just be crying, hurting so bad. And her therapist just kept pushing her and pushing her. That's not what you do for these patients.